Hi, everyone. Welcome back and welcome to week 4. This week, we're going to be talking about solution focused brief therapy. So, let's start out by talking about what it is. This is one of my favorite therapies to use with clients, and I think you'll find a lot of value in the techniques and hopefully will be beneficial to your own clinical practice. So, solution focused brief therapy began as an outgrowth of short term family therapy and the research surrounding it. The research found that the meaningful change often occurred between the time of the initial referral and that initial phone call and the start of the first session. This suggests that change was brought to sessions by clients, not something initiated by the therapist. It's based in the foundation of treatment focusing on solutions rather than problems. So instead of focusing on the presenting problem, therapists look for constructive changes already happening in the client's lives and seek to build on those changes. Solution focused brief therapy, or SFBT, has some distinctive elements that make up its framework. These include SFBT being grounded in positive psychology. This means it's a collaborative approach focusing and building on client strengths. You're focused on attaining goals as opposed to resolving problems. Next, there's brevity. SFBT is one of the briefest short term therapies available. This is mostly because you're spending a lot of time focusing on what's going right and not spending time on exploring past problems. You're diving in, you're focusing on the patient's goals and aims, which can prevent a lot of time consuming resistance that patients can present with when they initially start therapy. Next, SFBT is patient centered. It begins with the patient's goals and focuses on the best way to achieve them. And lastly, SFBT focuses on building from the patient's strengths that are already present, instead of teaching new skills, such as what you might find in cognitive and behavioral therapies. So, what does FSBT look like in clinical practice? And that should say 5 processes, not 4, so I apologize. Um, there are 5 main ones we'll talk about, which is procession change, the miracle question, searching for exceptions to problem patterns, scaling questions, and positive feedback and homework tasks. So procession change refers to the positive changes, however small, a client has made between scheduling the first appointment or participating in the intake process in the first session itself. This is based on the idea that there are some changes that happen between the initial consultation and the first meeting. This initial procession conversation can lend itself well to the start of identifying solution focused goals moving forward. It's asked in an open ended manner so the client can identify both positive and negative changes, but it allows the door to be open for solution focused conversations. Next is the miracle question. Now, this is a technique that is especially useful when you're working with clients who might be struggling with identifying positive goals for therapy. It's fair to think that when a client starts therapy, they're focused on what's going wrong, what's bringing them there, what issues made them seek out therapy in the first place. The miracle question really helps the client shift their focus to an ideal future where things are going well. The question goes something like this. Let's say you went to bed tonight, and while you were sleeping, a miracle happened. You wake up the next morning, and all the changes you hoped for in your life are suddenly made. When you wake up, what would you notice is different as a result of the miracle? How would you know that a miracle had happened? So, this is a powerful question that you can ask yourself or even utilize with a client in your practicum setting if you want to explore its usefulness. It really opens the door to solution focused thinking and assists the client in breaking down their own barriers to finding solutions. Another distinctive feature of SFBT is looking and finding exceptions to problem patterns in a client's life that contains the needed ingredients for powerful solutions. So, generally, problem patterns are not pervasive and they wax and wane throughout periods of the client's life. In SFBT, you want to identify the times in the client's life when the problem pattern didn't exist or wasn't happening. So, for example, A client comes in and says they're having a really difficult time with their anger, and they always yell at their kid after their kid tells them no. The problem pattern here is yelling at their kid after the kid tells them no. Searching for exceptions would be exploring with the client. Do you always yell after they tell you no? Has there been a time you were able to respond calmly? What was happening in that moment when you responded calmly? What helped you respond calmly? How did you feel after you were able to respond calmly? So, as you can see, we're able to find some exceptions to the yelling and explore the strengths the client already has to prevent yelling at their kid. From there, we can highlight the client's resilience and build on the skills they already possess. Next is the use of scaling questions. Scaling questions are used to track movement towards the goal identified or the goals identified in therapy. It's a concrete way of gauging progress, but also identifying ways to increase progress if there hasn't been a change in the scale. It's important to get a baseline number for the identified goal. So, for example, let's say a therapy goal for a client is to respond calmly to their kid after the kid tells them no. On a scale of 1 to 10, with 1 being not responding calmly at all and 10 being completely able to respond calmly, where would you rate yourself today? So, some follow up scaling questions to identify what's been going well or what might need to be improved could be, okay, so you said you're a 5. That's great. What's happening to prevent you from rating yourself a 3? Or, okay, so you said you were a 5. That's good. What do you think you would need to rate yourself a 7? Last but not least, positive feedback and homework. At its core, a therapist using solution focused brief therapy is an advocate for positive change. The therapist is consistently highlighting the positive movements a client makes and compliments small accomplishments. A lot of times, these compliments are incorporated at the end of a session when summarizing the progress made so far. This can lead well into the assignment of homework tasks, which are incorporated into therapy as a means of bridging the time gap between sessions. The homework task should be concrete, clear, doable, and tied to the treatment goals. Also, it's important to remember when we say homework, we're not referring to skills teaching, such as what you would do in cognitive and behavioral therapy. We're talking about ways at home the client can practice, identify, and strengthen what has been working well for them. Also, just a side note, if you're working with kids and especially adolescents, I suggest finding a different term than the term homework. In my practice, I've been met with a lot of pushback about the work since it sometimes reminds them of school. So even a simple change to calling it at home practice or at home strength building can be some good alternative. Just a side note on that. All right. Well, thank you so much. I'll see you all next week.